positive. And because in this time of a situation, what's really happening here, it's not only the health staff to know these things, what is going on, and the people out there also suffering from this pandemic. Not only the health staff, even the laymen, even all the people of this Manipur, all the people outside it also. All the people are facing a problem, not only the health staff. So when you come here to know what is really happening here, I feel very good.
Okay.
Because we are dealing with the needy, emotional patient who is really in need during this time, and we cannot share most of the problem because this pandemic there was a lot of problem. So we try to keep all this problem and do whatever we can do it. Most of the patient and the patient party was saying that they must cooperating and they are very much improving. And from our side, we bring our best. Whatever we can do in this pandemic time, we are here.
Currently, you have how many inmates? May I know how many inmates currently?
Currently, 41 is here.
And then, what facilities are available here currently in this center?
So when it comes to the facility, the patient, first of all, I will tell you the lodging. They are in a barometric room with the two bed, and they are quite okay. And the government provide the food, and there is no any problem for water also, and those things are easily available. And we provide the drinking water also, and we provide them the free of medicine also. And for the test, we send them to our distributor free of cost. And these things are the facility available, and we are providing the oxygen which is in need of this patient only. So this is the facility where here, and our staff and nurse and with doctors, we are 24/7 here only. So this is the facility available here.
In this center, may I know the patient who are here are mild or critical, or in which type of patient are currently?
Currently, we have all those patients here.
Okay.
Mild though, which is we don't give here mild care, because it can be managed in the community home isolation or home isolation. This is beyond this, which is not manageable with the home isolation. So we keep it here, and here we have a severe patient also. So if it is severe enough, we refer the patient to our isolation ward at district hospital, and these things how we are going on here. Regarding this patient, we are dealing whatever we can do here. So like this is not a hospital, this is a COVID care only. Whatever we can do, we are doing our best. And whatever the patient is very much severe, in need of this further management, we just refer to what are the issues.
And according to you, since the pandemic is not yet slow down, I should say, the rate is still keep on increasing. So what message would you like to convey to the public to take measures so that this the curve will be flattened with time? So may I know what measure, the best measure, I should say.
Okay, and this regarding this best measure, I think all the people will be aware, because our government has given a lot of guidelines and also is to be followed by this by the And during this, recently there was a strict guidelines and strict curfew also, and it has been extended to the start of this month also. So during this time, the people out there are also suffering, and also health staff also suffering, and even the patient who have staying with the patient party also, they are also suffering. So by seeing all this, whatever the government gives the guideline, please follow it, and those only necessary, those only necessary requirement of our life, those needy of our life, please do only that part. Whichever this can be avoided, like going out with the friends and get together something, and this part has to be stopped, because we don't know what is happening in one's family. So it's different with one family and another family. What's happening in the family also, it's totally different. So this my relatives happens like this, and this happens like this. We should not be in contact in this time, because other family and our family are totally different. Means in this case of pandemic only, how who is suffering in their family, we don't know it. And even the people out there, they don't want to get tested. So early, my suggestion is to get tested early, and to be tested early, will be diagnosed early, and if we are given the treatment early, then the recovery rate is very high, and recovery rate is very good. So if we have any symptoms, the people will be knowing all these symptoms, because this COVID is almost 1.5 years. So they may be having some symptoms. So if they find any symptoms, please isolate that first member of that family. Please isolate that member and get tested. And if found to be positive, or if it is very mild, just isolate him. If it is very severe or something, it is moderate, please take to the authority of the district. So that he only gets suffered, and rest of the family members will not be affected, infected. So what my suggestion is, this is becoming a war, COVID war. So all the people may be knowing about the symptoms. So the first member of the family who get the symptoms, please isolate and get tested. If it is diagnosed, then early treatment is the best way, and other family members will not be infected if it is isolated. So this thing, if it's going on, then the cases here in the Jusampur district also is very much high. So I think this will be decreasing the positivity rate here in the district also. Not only in this district, it will be entire country also.
Patients who are trauma, who are immediate trauma or depression patient, for them, do you have any facilities or care facilities like support, what we call psychological support?
Regarding this GP, we have 3 nurses on GP and 2 MTS and 1 doctor, and we had a team who are going on the duty. So starting early from the morning, we just follow up the file. So the nurse go for the injection and filing out and the paperwork, and go for the rounds. And the new admission comes, and we take the history of the patients, and we have to enter wearing the PP, and it takes around 3 to 4 hours to complete all the round. And once it finishes, we have to go for the paperwork again. And the new admission comes, we have to get other patient who have to discharge. And this seems going on day and night. So regarding this trauma case, till now we don't find any trauma patient here. And psychological support we are giving a lot of counseling to the patient, because patients who are here have a lot of anxiety, including the patient attendant also. So we're giving a lot of counseling, and we have our hub line, the district hub line numbers there. So any trauma case comes out to be here, we will definitely refer the patients to the casualty, because the casualty is the only options that we get really is available out there to manage the trauma case. Once the patient is stable, and they will definitely see the patients, or whether they can give an ISO word or the CC, they will decide. So for that part is quite manageable, and for the psychological support, we are doing our best. And once for the regarding treatment, we have a hotline number. So challenges, it depends on one's whatever. There is two sides. One is health side and one is patient side. And these two sides, our governments and our district authority, they try to fulfill all those things. But regarding this, our work, regarding the work with regarding treatment of patients, there is nothing unsafe. It is my physical activity only. So the physical activity can't be related to my hardship, because this is my duty to serve the poor people, poor patient here. So regarding this foodings or lodging is something is quite okay. And the government provides everything, even they do not lag behind its medicine part also. So the hardship I face here is treating the patient. So this treating patient is my job. So I cannot keep this as my hardship. So like during this pandemic time, we are here for the needy people here, the patient. So I cannot call this as a hardship. So regarding all those, my livelihood here is quite okay. And treatment part, I cannot say it is a hardship.
Tuni, Socio-Economic Association of Lamka Lanva Covid Care Centre, vehna Bakinayana, Hiai Komkomina, Hanfona, motivation Ichigama, Abakinaya, Tunina staff there, Nelmu, Inamua, Mautia Hiwa, Kakipapi Mamawa, Aku Kalnau le, Anasem Gimnau, patient there, Amau. Kukal takle de thotaka ana kipna te to ama sapena na sim na chupatu ahon gen yella tuni na ka silina ke vi akirba vena ke hi the tamakine ke ya amal te to kamkhat kamni vaki howa ke amal te bahan thon kha ka hi the sunwa hi ya tuni na ka tal swan nau ai bang hi ya amal te kipaak et sak na thil kia panyam ka pe utwa athupi ka hi zo ke hi le amal te han thon na le kipaak et sak na kha thil kia dio chik pe ut ka hi na wa ni tuna ka hiu tu lamka ka he tu ichiama Lamka Circle Circle ka he tu pa swani ni sigleta ni na Lanva Covid Care Centre na theihtuak ong theihtuak sak le chi na ama ko ta theihtuak kan na ama kan ni na ko la